A lot of patients ask me why dentistry is so expensive, and I see a lot of the time when we're talking through different options and different prices, people's eyebrows are getting higher and higher and sort of disappearing to the back of their head. And it's something that not a lot of people want to talk about and not a lot of people like to talk about. So I'm just going to spend the next couple of minutes trying to give you some idea of what goes on behind the scenes when you're paying for something, how actually having that slightly higher price normally means you're getting the best quality, using the best products, and so actually it's the best thing for you. So there's a lot of obviously equipment we need, materials we need. We have a lot of regulatory bodies who cost a lot for sort of certain insurances or to be on certain bodies, and for everything to be working and healthy and sort of behind the scenes. Another big cost is materials. So for me personally, I use a very limited amount of very limited style of composite. All my composite comes from the States. All my composite is exactly the best quality. I know exactly how it works, and I wouldn't use anything else because I can't guarantee my work is going to work as well if I'm not using this particular material. Does that mean that my dentistry is a little bit more expensive? Well, yes, because instead of going around the corner and buying something for $5, I'm spending £500 on it. Another reason dentistry can be a little bit more expensive is if you're seeing someone who invests a lot of time in their ongoing education. So this year I'm doing a diploma. Last year I did another year-long course. All of this costs money, all of this takes time, and what I'm actually doing is I'm investing in you. I'm investing my time, my money, to make sure that I can give you the best options, the best treatment. So when you come and ask me for a filling, I can give you the best filling with the most up-to-date knowledge, the most up-to-date techniques, to ensure that your filling lasts as long as it possibly can, and you have minimal problems with it going forward. As we all know, money makes the world go round, and there's a limited amount of time in each day for us to work. Unfortunately, I don't want to stay till 2 o'clock in the morning. I do like to go home and have my dinner. So everything's sort of time calculated. Now, all my treatments take a certain amount of time because I want to make sure that I'm giving you the best quality. If you think that someone can give you the same service, the same time, the same care at 50% off, well, that's a bargain and you should go for it. But that isn't what I'm seeing. I'm seeing routinely work coming back to me that's failing, things that haven't quite gone to plan. Someone thought they were going to get something, but actually they've got something a little bit different, and we're having to go in and redo the work. Now, sometimes, if you're lucky, it's really easy for us to redo the work. We can take out that filling that's failed and put a new filling in. Sometimes it's a little bit more tricky. If there's been irreversible damage to the tooth or teeth, or on much larger scales, sort of implants and things like this, to correct those problems costs even more than it would have if we'd just done it right in the first place. When I'm talking to patients and colleagues, what I try to get people to start thinking about is not just the financial cost, not just the time cost, but also the biological cost. A lot of the time when things are done quickly and in a rush without very much planning, then the biological cost, so what this means for you is how much damage is done to your teeth, is huge. So for instance, when we're giving you a smile makeover, I can cut down your front 6 teeth and stick a whole load of veneers on, which can give you an instant, pretty good smile. Or I can take the time to plan the case properly, put the teeth into the right place, maybe do some whitening, maybe just do some edge bonding. And although that process costs more, takes longer, actually the damage to your teeth is so minimal, it's going to last a much longer time and give you your teeth for use of your teeth, for a much longer time. If cases are planned properly, then the biological cost is very low, and I think that is actually the most important thing coming through, especially with dentistry at the moment, is making sure that that we're being as minimal as possible. Of course, I can't talk about the cost of dental treatment without going into a little bit about dental tourism. So there are a lot of places where people are going to find cheaper treatment or alternative dental treatment to having it done in the UK. When people have asked previous dentists about this, they've been told off. They've been told, don't go there, you're going to get terrible dentistry, you're going to get ripped off, and it's all going to fail, and I'm going to have to sort it all out. And actually that leaves a really bad feeling with you and a really bad feeling with your dentist. So what I try and say, and what the message I try and give you is, actually there are good and bad dentists in every country. There are good and bad dentists in the UK, there's good and bad dentists in Spain, there's good and bad dentists in Turkey. The most important thing is that you're choosing a good dentist. Now, you speak our language here, you speak English, you can pick up on social cues here, you can walk in and you know if you feel safe, if you know someone wants to look after you. If you go somewhere where you don't speak the language and you're not looked after, how can you make that judgment call? It's much more difficult. So you just have to make sure that you feel confident in your choice of the dentist. And again, it's going back to that same thing, biological cost and quality rather than always being led by financial cost.